Hello, my name is Brandon Carter, and today I'll be doing a presentation on the health policy in Taiwan. Some of the objectives we're going to cover today are as follows. We're going to briefly explain or examine the healthcare policy of Taiwan. We're going to examine the coverage access. We're going to examine the quality of care, examine the costs for care, and examine the patient choice in Taiwan's healthcare system. Healthcare policy in Taiwan. Taiwan has adopted a national health insurance system in 1995. Healthcare in Taiwan is considered as one of the most highly efficient healthcare systems in the world today. Every citizen in Taiwan is fully covered, and there is no such thing as a pre-existing health condition. The government administered insurance-based national healthcare system may sound amazing because in Taiwan, no matter if you have a decent job or you're jobless, you are covered by the so-called universal healthcare coverage. The healthcare system is a single-payer system, and Taiwan's healthcare system is known for good accessibility, comprehensive population coverage, short waiting times, and low costs. Compared to the U.S. healthcare system, Taiwan requires everybody to be in and not out. The rate you pay for service may be slightly different, but the minimum monthly payment is really affordable. For most citizens, they pay less than about US $50 per month than you would in any other country. Next, we're going to talk about coverage. The National Health Insurance covers almost all services that can be provided by a health system, from dental care to parturition, from Western medicine to traditional Chinese medicine, and from preventative services to elderly home care. To finance the scheme, Taiwan chooses a national health insurance system, a single government-run fund that forces everybody to join in and pay. So because it enforces everybody to join in, it is a high coverage rate, which is about 99%. In fact, citizens in Taiwan who move overseas can still maintain their residence of registration in Taiwan and also are covered by the national health insurance and are required to pay the minimum. So even if you leave Taiwan, you're still covered fully. Next slide. Next, we're going to talk about quality. The health quality in Taiwan is very different because Taiwan has a health seeking behavior which is relatively high. Being in good health is adamant in Taiwan's culture, which leads to seeking medical help frequently, even if it's for a minor illness or injury. The quality of care provided leaves most residents of the country with satisfied services with their healthcare service. However, since Taiwan is a country with high health-seeking behavior numbers, the average visit rate per year per person is about 14 times. The reason behind the vast amount of visits stems from each patient receiving no more than 5 minutes of physician time during a consultation. Short contact time may result in poor patient-physician rapport and inability to deal with complex problems in one visit. As a consequence, patients often attend for a second or third opinion, which could contribute to the value of care provided being in question because so many visits are required. Next, we're going to talk about the cost. Since Taiwan has adopted a single insurance system, Taiwan has the lowest administrative cost in the world, which is less than 2%. They also incorporate a smart card to track patterns of use, and because of that, no one goes bankrupt because of medical bills. To cut costs, a review is conducted by a panel review system of medical records to keep healthcare costs down. Procedures considered inappropriate by the specialists upon the review panel will not be paid, and therefore funding will be cut for whatever is not considered to be appropriate. And lastly, we have choice. Patients can normally see any specialist they wish to see during the usual working hours. There is generally no wait list. Depending on the severity of the incident or illness, a patient may see an any orthopedic specialist, pain specialist, neurologist, or a family physician directly the very next morning. The only exception and downfall when it comes to choice is when the physician whom the patient wants to see is very popular, there may be a waiting list for that appointment. The Taiwanese people are able to choose their healthcare providers freely. They have no gatekeeper. There are different ways to provide universal healthcare coverage, and Taiwan has definitely explored its options to achieve universal healthcare. However, with any good thing, there is drawbacks, but the country of Taiwan is still has a thriving healthcare system which benefits all and leaves all residents satisfied. If you were to describe Taiwan's healthcare policy, one would categorize it as cheap and abundant care, which continues to achieve a high satisfaction rate among the Taiwanese people. So these are the list of references and the end.